In this video we will discuss about the toxicity check of IL-2 based nanoparticles against ovarian cancer. So this experiment is done in the in vivo studies because this is the right in vivo studies is the right uh, choice to check the toxicity effect of this IL-2. So what they did is they first inject the tumors, and after 7 days they inject the IL-2 construct of different combinations that we have discussed so far in our previous videos, and at 14 days they again inject this IL-2 construct. And first they check the tumor bioluminescence signals, and what they are able to see is that after third day there is a dramatical drop in the bioluminescence signals of the tumors, and this drop continues to around 18 days, and from the figure it looks like that. And thereafter the tumor reoccurrence starts to show up, and this reoccurrence, although it shows up in all the cases, however this reoccurrence is slower in the case where they use Mal-Lbl, which has this IL-2 based coating also. And when they check the mean survival rate, they are able to see that this Mal-Lbl has a higher survival rate of 44 days compared to the other case where compared to the all other case which has a mean survival rate of 30 days. And also in the case of Mal-Lbl, they are able to see that 30% of the mice are completely able to recover from the tumors. And the reasons that they are able to see is that they check the IFN gamma levels, which is the effect of this interleukin 12s, and they are able to see that IFN gamma levels are high. IFN gamma levels are high for this Mal-Lbl case compared to the all other cases. And this one results in the supplemental figures are also shown that when the mouse that are able to recover completely from the tumors, when they are again injected with the fresh tumors, the fresh tumors are not developed in those kind of mice. Whereas when these fresh tumors are injected into the naive mice, they are able to kill the naive mice if they are not undergone any kinds of treatment, indicating that if the tumors has been cured in the mice using one of this treatment, then it will develop immunity against those kind of similar kind of tumors. Next, they wanted to check the tumor infiltrations in this tumor microenvironment or this tumor ascite sites, and also in the tumor nodules. So first they check in the tumor ascite sites, or the results that are presented first of the tumor ascite sites where they inject. The experimental is done. Experimental plan is shown in this panel E, where they inject the mice at day 0, and then at day 10 they inject this IP treatment of interleukin 12 based nanoparticles of various combinations, and at day 12 they did the flow cytometer analysis. And what they're able to see, they check many different immune cells. However, the significant difference in these T cells has been identified, where they see more CD8 to CD4 positive T cells in the case of Mal-Lbl, whereas all in the other case this rise is not high. And these things they have quantified in this panel H also, where they can see that CD8 to CD4 positive cells are shown are higher in the case of Mal-Lbl, and this CD8 to CD4 positive T cells are known to have anti-tumor effect against the ovarian cancers. And they also check the total number of T cells. They are also increased in the case of Mal-Lbl in the ascite sites, tumor ascite sites. Then they did the similar studies on the tumor nodules, and they are able to see the similar results. That is, T cells are high, or we can say that the CD8 to CD4 plus high CD8 to CD4 ratios T cells are high in the even in the case of tumor nodules. And these things they have quantified in the panel K, where we can see that the CD8 to CD4 are high only for this Mal-Lbl, but in all other cases it are lower. And the total amount of T cells are also increased, where they use LBL based interleukin 12 nanoparticles, and this is same as this Mal-Lbl nanoparticles. This is just a different name of the same approach. So this all indicates that this cytokine based approach against these ovarian cancer cells has a more anti-tumor effect, has a more anti-tumor response compared to the all other cases. Even when they use the free IL-12 cytokines, it will have a negative effect because free IL-2 cytokines can have a non-specific binding and can cause that results in the uh, non-specific reactions. So this is why this cytokine specific targeting against the ovarian cancer has a better results. So far this is what they have concluded till this figure. So if you need to understand more about their experiments and even go through the supplemental results, you can refer the reference that has been provided in the description. That's all for this video. Thank you for your time.